Hi, everyone. I'm Randy Murphy, epidemiologist and director of disease surveillance here at the Mobile County Health Department. We are glad to be with you today on this Thursday, September 30th. Today, we are reporting on 71,363 cases of COVID-19. 87 additional COVID cases were reported to us yesterday. Yesterday, we got the report of 30 COVID deaths, bringing our cumulative number to 1,261. And remember that the daily increase of deaths may include COVID deaths that occurred in previous weeks or sometimes even previous months, but they were just reported to us in the last 24 days. The Alabama Department of Public Health put out a really nice message explaining that the median number of days from date of death to receiving a certified death certificate is about 25 days. So we know that death certificates and death notices can be very delayed coming to us. The total number of people hospitalized with COVID is at 8,813. 20 additional people were hospitalized with COVID or diagnosed with COVID while in the hospital yesterday. The number of people in the hospital yesterday in Mobile with COVID-19 stands at 104. We're so very close to that number getting below 100, and we just are so glad and relieved that the number continues to go down, and that is giving our hospitals some much needed relief. See, just wanted to review a CDC Health Alert that came out. So a statement on pregnancy and COVID. So CDC issued an urgent health advisory to try to increase COVID-19 vaccination among people who are pregnant, recently pregnant, including those who are lactating or who are trying to become pregnant now or who might become pregnant in the future to prevent serious illness, deaths, and adverse pregnancy outcome. So again, the advisory strongly recommends COVID-19 vaccination either before or during pregnancy because the benefits of vaccination for both pregnant people and pregnant moms and their fetus or infant outweigh known or potential risks should you get COVID-19. So again, the advisory calls on health departments and clinicians to educate pregnant people on the benefits of vaccination and the safety of recommended vaccines. So that's what we're trying to do here, is just to remind everyone that if you are planning to become pregnant, if you are pregnant, or if you were recently pregnant, please talk to your provider about getting vaccinated. CDC went on to say that through September 27th, so just a few days ago, there were more than 125,000 confirmed cases of COVID in pregnant people, including more than 22,000 hospitalizations and 161 deaths. So 22 of those deaths occurred in the month of August alone. Cases in COVID-19 are pregnant people with COVID-19 are at increased risk of adverse pregnancy outcomes that could include preterm birth, stillbirth, and admission to the ICU of a newborn also infected with COVID-19. So again, Centers for Disease Control, looking at all of the data that they have on people who are pregnant or have just given birth, looking at their health effects if they get COVID and the potential health benefits of getting vaccinated, balancing vaccination with benefits and risks. And so far, all of the data says that the benefit of getting a COVID-19 vaccine, if you're planning to become pregnant while you're pregnant or shortly after being pregnant, far outweigh the risks associated of getting COVID if you are pregnant or planning to become pregnant, or if you've recently been pregnant. So let's see, there's just a few questions today. Someone saying disappointed in a response that I gave earlier in the week that high risk people who are vaccinated, that because they're vaccinated, that they're not eligible for a monoclonal antibody treatment. So what we're trying to do is, there are just not enough availability of monoclonal antibody treatment to go around. I heard earlier on a state call that the state is only able to fill monoclonal antibody orders about 40% of the orders. So the treatment is on allotment right now, and where the state can't fill all the orders. So when treatments are in short supply, what we have to do is try to prioritize those that are in a situation where they could get the most benefit from them. So getting vaccinated will give you a great amount of protection from hospitalizations and deaths. Someone who's not been vaccinated and has COVID, their only option is to try to get monoclonal antibody treatment, and those are in short supply. So that's why we prioritize people who are unvaccinated and at high risk of severe complications and death. We prioritized a monoclonal antibody treatment that is in very short supply right now. We prioritize it for those. All right. Let's see. Someone saying, according to FDA, teachers are eligible for a booster. And are we offering it? Yes. If you meet one of those categories of being eligible for a booster, we will give you your booster 6 months after your primary series was complete. So you don't have to show documentation of the work that you do. You don't have to explain when you see the flyer that says, these are the 4 categories. All you have to do is say, yep, I fit one of those categories. And if it's been at least 6 months since you got your last Pfizer dose and you are over the age of 18, we will give you a booster dose. Someone wrote in asking about a location offering Comirnaty. So Comirnaty is the same vaccine that we've been calling the Pfizer vaccine since December. What happened was it's the vaccine, any vaccine or any medicine goes by its generic name when it's being used under emergency use authorization. And then once it receives full FDA approval, it gets a proper name or a proper label. So Comirnaty is the same thing as Pfizer. And then I think there was another question in here. Something about under EUA, was there not anyone held liable for injuries? So I'm not sure about the liability question. I guess asking if someone vaccinates you and you have an adverse event.
Because they said, under the emergency use, there wasn't the liability. Does that apply now that it's fully approved?
Yeah, it doesn't matter if it's authorized or approved. The fact that it's authorized versus approved does not change liability or protections of providers giving the vaccine. Hope that answers that question. Maybe not. Okay. So is there anything else for today, Mark? Any questions come through while we've been on?
No.
Okay. So we don't have anything more today. Just want to remind you that you need to check frequently on MCHDcares.com. We have made changes to our vaccine clinic locations and hours. We're at our only giving walk-in. We're only providing walk-in vaccines and testings. God, this is having a tough time today. We're doing walk-in, no appointment necessary testing and vaccinations at our 248 Cox Street location, Newbern Health Center. We may start some community-based events again since we are only have the one clinic open, and again, that's based mostly on lack of demand. But check mchdcares.com frequently to see if we will be coming to a location near you. We're still working on finding what we're calling a storefront location, so stay tuned for that. mchdcares.com will be the best source of information. If we do have some, important or breaking information, then we will, schedule a Facebook Live and get back with you. But for some time, this will be the last Facebook Live for a while. I'm on leave next week, and then we probably will not have a regular cadence of Facebook Live until or if we have another big wave of COVID. So it's good news that we no longer feel it's necessary for us to provide these daily live updates. We will still be publishing our daily reports and our weekly report. You can find those on our website, mchdcares.com, or go to mchd.org. So you can still get those daily and weekly reports there. So unless there's anything else, we're just going to call it quits for today. And thank you all so much for what you've been doing in the community to try to get this very difficult, very challenging, very historic high wave of Delta-driven COVID pandemic in Mobile County on the downside. Remember, it's important that you get vaccinated. We want to prevent as many COVID infections as we can. Also, wear your masks, distance, stay at home if you're sick or if you've been exposed, and take care of yourself. Mark is reminding me it's important to get a flu shot. We want everybody 6 months of age or older to get a flu shot by the end of October is the goal for everybody. And there are a lot of different influenza vaccination types and technologies, and different ones are made for different age categories. So I think there are 8 or 9 different vaccine products for influenza. So please consult with your physician to decide which flu shot is best for you. But do get a flu shot this year because we're going to have, our seasonal respiratory viruses and COVID-19 co-circulating this year. So it could be a tricky winter. All right. Take care, everyone. Stay safe, and we'll talk to you again another time.